second edition of Med Music magazine by the students of the music therapy. We have an alumni of the School of Music Therapy, which is Bhuvaneswari Ramesh, who is an assistant professor at the School of Music Therapy. Myself, Gauri Selvi, and this is Sayan Chitta. We are the students of the music therapy, and we are happy to have you today, ma'am.
Thank you for calling me in for the interview.
So, ma'am, we have few questions prepared for you.
Yeah.
Are you ready? We can.
Yeah, shoot.
Okay. What inspired you to pursue a career in music therapy?
Okay. Honestly speaking, music has always been there in my life from my childhood. We've been listening to music, and many a times I've always felt music is something in an area in which I want to work with. But I think about always felt that music can be used to help people because I felt that it had helped me a lot. So I felt that when I was sad or when I was happy, I was able to listen to music, and it really helped me get through the process. And so when I joined, I think there wasn't much of music therapy as such. I think I started my music therapy journey in 2013, and that was the first course. And before that, I actually went for music school, and I learned under Karakuri Subramaniam sir. He introduced me to this therapeutic aspect of music, where he showed me just using the third speed of Jante verse that we have in Carnatic music, the basics foundations. He had a video that showed that stuttering can be reduced with that, and that really made a big impact on me. And the first thing that I told him when I wanted to join was, I want to use music to help somebody, to make them smile or to make a change. And that is how the journey started. And at any point of time when I felt I had doubts about the journey that I've had all of these years, is that how it has helped another person's smile. So when I go into patient care or when I do a research study, I know the outcomes. And that has always been my motivating factor.
Can you tell us about your journey to the becoming an assistant professor in the School of Music Therapy?
Okay. So that's quite a journey. I've just completed 10 years and moving on to the 11th year now. So, like I said, like I already mentioned before, I started my education in music therapy in 2013. I did my postgraduate diploma outside of Sri Balaji Vidyapeeth because we hadn't had a department at that time. So I came to Sri Balaji Vidyapeeth here for a music therapy department, which was here as an intern. So this was way back in 2014. For 6 months, I had come here to join and work here. And then there was an opportunity for me to work here. So I started working, and then I had slowly learned how to work with different clinical populations. So to tell you in a gist how I became an assistant professor, it has taken me about 8 years. So in 2016, we started the masters in medical music therapy, and at that point, I was a tutor. So I joined here as a tutor in 2014 August, and then I've been a tutor since then. But I did get an opportunity to study masters here in 2016-17, and then went on to becoming a PhD candidate as well. I'm hoping that I will finish this year. So the idea is how I moved on. In beginning, actually, there's this very interesting thing that when we joined here, we had only one department or two departments, and we used to have hardly 3 or 4 patients. So over this period of 10 years, we have developed that slowly. Most of the clinical departments, we are collaborating right now. So when we started, it was 1 or 2 patients in cardiology and 1 or 2 patients from psychiatry. And then we slowly increased. So my dissertation that I did for my postgraduate diploma was in gynecology. So I went in, I started working with the pregnant women. And then slowly we went on to dialysis. And then we got an opportunity to work more into cardiology. Then in 2015-16, I think the neurosurgery department was one of the most difficult areas to go in, but then we got a chance to work there as well. So slowly, I think we just got into all of the departments, endoscopy, most of the procedural support, dental college. So across the university, we have been able to work in different departments. So the journey has taught me how to connect with people, how to work in an interdisciplinary team, how to connect with doctors, how to work with patients, how to speak about music to them. So this has been the learning journey. And now, as an assistant professor, I think I have moved on from clinical practice and research, which I still am doing off and on, not as much as I would like to. The last 3 years, I have been working more on teaching practical, supervising students, coordinating the departments to have work done, research and publication. So I think the journey started with just learning how to connect with departments, then to know how to work in the different clinical areas, coordinate and supervise, and then on to teaching and to publication. So I think the journey has sort of gone there.
Like a roller coaster off and on.
Yes, yes, it was. It was quite a roller coaster journey, to be honest.
What do you find the most rewarding about teaching music therapy to students?
Oh yes, that's really amazing part actually, because like I said, that experience that I have had, more than teaching from the book, I find it much more easier talking from my experience. So when I have to teach a student, I have anecdotes to explain from. I can talk about the fears that the students will go through. So the most rewarding is that I think one or two of most of the students that I have been able to guide through, have shown that they have learned from me, and they find that my guidance has been of support, which is, I think, the most rewarding part. But also that when they come back with the clinical practice and they can discuss their patients, not just the patient care, but also their feelings and thoughts that happens during clinical practice, which is the most difficult part of training as a student in music therapy. That is when I realized that when a student can come back to a faculty or a teacher or a guide, that means we are able to give them something. And I think that's the most rewarding part of teaching music therapy students.
Yeah.
How do you incorporate experimental learning in your music therapy
Mm.
teaching?
Okay, so like in our curriculum, actually, if you see, the first semester is completely theoretical, and so the practicum also is based on role plays. So there also, I find that with the experience I've had, I know what kind of patients might have, or what kind of patients we may meet, or what kind of people you might meet, and what kind of issues we can come across. So when I can give the student a particular role play to make, and give them that this is the kind of problems they'll have, or to make them think from their point how it would be to be in a hospital and be a patient, and then come up with that idea, so that I'm not just telling them what they should do, but giving them the idea to think, to also self learn. So we all have had experiences. So it's about bringing out the perception of the students and putting them on the table, letting them be themselves, let them work, even if it is an over exaggeration of the situation that we are trying to do a role play on. For example, you're going into orthopedic department as a patient with leg pain. Some of the students I've seen would go exaggerate and make noise and all that. So giving them that space to have fun along with learning, I think, is the best way of bringing experiential learning, that is when it comes to theoretical or role plays without real time experience. But when it comes to real time experience, like in the second semester, students go for clinical practice, right? So the experiential session would be coming back and then being able to reenact or to talk about that. So I think experiential learning is about not just me sitting in one place and teaching, but it is about getting the reflection and the thought for the students. So it makes for a better learning, not only for them, but I think I have learned a lot from the perceptions that the students have.
Would you like to share a memorable experience from your time mentoring students?
Okay, mentoring students. Um, yeah, I think the most memorable. I don't have one, I have many, though. But I think it's a process. Mentoring has always been has been a huge process. But um, when at the end of a mentoring session, the student actually understands what I'm trying to explain. Because mentoring is not just with the teaching or the learning or the clinical practice. The mentoring happens across the personality of the student who is working through that the work with patients, and they go through a lot of emotions and thoughts, which sometimes if you don't give the thought and try and explain things, they're going to be living with those thought processes and it's going to be very intimidating for them. But it takes some time to try and explain. So, for example, I've had a student called Tarang, who is from South Korea, and she had a lot of issues with cultural aspects because as a foreigner, people look at them in a very different way. In India, in the rural population that we are right now in Sri Balaji Vidyapeeth, they all look up to a white person or a foreigner in a very peculiar manner. Or they give them too much of importance, and for her it was very difficult. So I had to go through this process of explaining to her over a period of time, and then after about 8 to 10 months, she started understanding. Oh yes, so it's okay for them to be like that. I will just have to be okay with that. And then slowly she started understanding. And for her, it would be like, "Ma'am, now I understood." So it is that excitement. I'm like feeling a sense of relief. Okay, I think they've understood. So, and I think not only this, but I think some of the students have had personal issues. And when they come to you, with that personal issue. And it's not like we can in any way solve the problem, but if we can be there just to handhold and to listen and to be there as supportive, I think that's a very major important aspect of mentoring. So there was an incident in the last 6 months, and I think I may have played a good part. So yeah, there have been some areas that I have been able to help clinically, culturally, and also personally. So I think mentoring is a process. There's not just one. If I start talking, I think I'll have too many things to talk about. So
It's very supportive for a student actually.
yeah, thank you.
You have conducted many research studies and published several articles. Tell us about your one of the favorites of them.
Honestly speaking, everything has a story behind it. So I don't know if I have a particular one, but I think the first publication was the one that I with great difficulty did the study, and then it got published after 1 year. So the excitement was quite a lot for me because it was always in my mind, like that I want to have one paper published. So I didn't have any idea how to write the paper, but I went through the process of learning how to do it. And when it came out after 1 year after I did my study, that was the most joyous part of my thing. But I think other than that, the most other one would be the paper that got selected by music medicine, and then they picked that paper to become the nominated paper for that month of the journal, and that was very interesting and very happy for me because from the Indian context there are very few publications that comes out into international music therapy journals. So it felt good that there was something unique about the paper that I had done, and it was also a part of my PhD. So there are multiple reasons why I find that to be a very close to heart journal. So, article.
What topic was that paper on, ma'am?
Basically, it is on the endocrine markers during lactation. So my PhD study is on the effect of music-assisted relaxation and directed imagery for primary gravida mothers. It is the first-time mothers who have delivered normally, and my evaluating parameters were oxytocin, prolactin, and oxidative stress. So the endocrine markers are a very different biomedical part of research, which is also quite rare in the music therapy arena. There are studies which are still coming up, but the funding really crips the work that we are trying to do. So biomedical areas are very difficult. Normally you will find a lot of studies that talk about the brain waves and the changes in the brain with and the processing of music in the brain and all that. But the biomedical aspects and the endocrine markers have just now started popping up. So I think they may have found that to be a unique aspect to pick it up as a article of the month.
That's great.
Thank you.
Your review on the impact of music therapy and the influence of Indian classical music on endocrine marker in pregnant women was highlighted in an article. Would you think, what do you think make this research significant? I think.
Yeah, so like I mentioned, music medicine, when you look at music therapy journal as a part of it, you will find a lot of theoretical aspects, qualitative aspects, neurological aspects. And when something very unique like a biomarker, like I said, biomarkers are very difficult to even evaluate, quite expensive because, first of all, getting the samples, like blood samples or salivary cortisol, saliva samples can be very difficult and ethically not easy to get. So I think the research aspect has been very less. Also, to look at the Indian classical music being a part of it, I think that may have been a unique aspect for someone who's looking at it from the outside of India. Because now India is growing up as a global, people are becoming aware of the work that we're doing in India. So I think that could have been also a study on biomarkers from the country where there's not much of music therapy yet. From a music therapist point of view, might have made, maybe these are the different aspects that made it unique for them to pick it up.
Okay. Great answer, madam. Could you explain how your current research on the biomedical parameters in location could impact the field of music therapy?
Yeah, so I think we're going on that same line. Basically, like I said, we have a lot of literature on how music is being processed in the brain. We have a lot of literature on how music has an effect on stress markers. But there are no original articles. There are studies. In fact, most of these studies are done by medical people within the country, at least. So the doctors who are there or the clinicians, they are the ones who have been doing the studies, because the accessibility to understand or to spend money or the funding that is required is more easy for them to get. But for, I think the mechanism can be explained more. Now we all understand how when we listen to music, it is a process in the brain, and then oxytocin flows through. There's this HPA axis that can be explained. That's a separate thing that we can talk about. So basically, what happens is there is a movement within the body, the endocrine markers. So what happens is the mechanism can be explained, and we have an output. So we have data that can give you a backing and a mechanism to as a foundation of the theoretical aspect. So we all understand how it works, but do we have data to connect it to that mechanism? That's what we try to do. So I think this, if this goes on, there are much more work to be done. I've done like the topmost tip of the iceberg research, but there are much more now within these biomarkers. There are many types of biomarkers that can still be looked into. Just taking the white blood cells or the red blood cells, there are just the glucose levels. You can do so much more. Metabolic syndromes, for example, in yoga therapy, they're doing a lot with metabolic syndrome, but that takes a lot more expertise and lots more time and requirement to do such studies. But I think this is a footing for us to look forward in, and probably also try and get funding for further work. So this could give that foundation, saying that we have this study, we'd like to do more. Yeah, which is one of the major disadvantages we have right now, funding for studies and to make much more scientific research output.
You have worked on community projects with diverse groups, such as the transgender community and children with special needs. What challenges and rewards have you encountered in these projects?
Um, Okay, first thing was when you take a transgender group, first of all, just being there. I think the first thing, I really find it challenging, to be honest, with children also. I don't have much of an experience working with children with special needs, but it's most rewarding than challenging for me. The challenges is only traveling from one place to another, carrying our instruments when we don't have a vehicle. I think that would be the challenge. But most often, I think it has been very rewarding because music plays such a beautiful role with children, and they don't analyze and they don't look at whether it's having an effect on them or they don't have something that they think of. It's just you doing something that they like and the connection that they can have with you. So I think it has been quite rewarding with children. But the only challenge would be I couldn't do much work there. But I think it has been very interesting for me to see how I could guide the students further. So one of my students actually did something with children with Down syndrome. So he used improvisation and music, song lyric one of the songwriting techniques to teach and movement of to see the change in the movement or the stride length of children with Down syndrome. So there are also other students who are doing work, and it's very interesting to see how they are going through it and how I can learn more from that. But when you look at transgender community, they are quite vivacious and quite energetic. In fact, after a few sessions, they would take on that session and do it on their own. And the energies are so high, they would participate without having an inhibition. And for them, it is if you go as a therapist, the only suggestion that I would give is go to them as looking at any new human being and not as a transgender. They are also human beings. So for them, it is always about acceptance. So if you could give them a chance for them to feel included, to feel that hurt, that they are hurt, I think it's the best thing that you can do, and that is quite rewarding because you can see the emotions that comes out of their thought processes, their ability to talk about the most vulnerable points. The ability of them to write songs. They write poetry in Tamil so beautifully. Their language skills are so good. Their energy levels to dance and express themselves, to be a good community. And even now, if they see me somewhere, they'll be, "Madam, how are you?" and all that, and that bonding that they create is nothing that can be compared to. So I don't know if I've actually had challenges, but in the beginning, I think for anyone they would have this fear of, okay, will I be the right person or will I be able to handle it? But I think generally I'm sort of comfortable. I don't know if I'm seeing a difference in any kind of these people. It's only about how would they look at us differently was the one question I had. But no, they don't. The moment you show them genuinely, you're not looking at them differently. They are there for you. They are good friends as well. So I think that has been one part of it. The other community areas would be with geriatrics. Geriatrics are elderly people, and you go there, you have all their prayers. You just have to be there for them. They're alone, they're sad, they feel lonely, they have body pain, and they also need a place to express. So taking them back to good times, listening to them, giving them the time. I think with music, it can play a very huge role for them to feel that we are a part of them. You are coming for me. So they look up to you as their own children that they can't be with. And that, I think, the space that you create in the community for yourself can bring about bonding. And like I said, I don't know if there were any challenges. There were most of them are just rewarding for me as far as I can
Do you
understand.
miss going to the community groups?
Oh yes, oh yes, I do. In fact, I miss going to the fields. We used to go into the fields and work with the farmers. They would take us into the farms. I have gone and I've done farming with them. I've cut the grass and all along with them, and they take us to the temple and we dance along with them. They'd sing for us. Like, we wouldn't know their songs, so we'd go into the fields and find out in that village who is the most the best person to sing. And they would sing and they would tell you stories. They took us into this there are these lakes nearby where we are. You go down like about 5 to 7 kilometers down this beautiful fields, and there's a huge lake. So they took us around that lake and they tell us stories of how they used to come there as children, or this is here, this is here, this is how we used to be. And that ability of them to show them their space, that was so good. So, it's really interesting because it's not like patient care. We are not doing any therapeutic aspects. In fact, I feel it's more therapeutic for us to be a part of that community, to learn about them. And for them, it is an experience because they're telling you their stories. And for them, it takes them away from the difficulties that they go through. So I think, yes, yeah, I do definitely miss going out. And that's another way to get out of this place and, move out of the hospital and do something outside.
Yeah.
Yeah.
It's surely a great experience, ma'am. Uh, how does music therapy integrate into healthcare service, and what do you see as its future in India and globally?
Ah, okay. So to be honest, I think music can penetrate into every part of the of an university. Right now, I think currently in India there are a lot of people who are interested in this, but to take it to the next level, it might take another decade for it to spread throughout the country. But I think right now, what we have done within this hospital, and there are other hospitals who are actually asking, but we don't have enough people to go there. So the idea is, from my experience, I have found that there is going to be these two different kinds of medical people. One who are those who are comfortable bringing in other kind of therapeutic modalities into the treatment model, and then some who are still very apprehensive or not too sure what we are doing. The idea is about them experiencing the changes that they see in the patient care. And I have found that is the best way to penetrate into a healthcare system. So, for us to be able to integrate, they should first be able to accept us. And for that acceptance, we need to show them something. So, I have found whether it is neurosurgery or it was in cardiology, where there were two doctors, one was pro music therapy, another was not so pro, towards positive towards music therapy, and the changes found in NICU. One of the alumni who actually went in, the first day she was very snubbed by the PGs of MBBS, the department. But the next couple of days, she knew how to go back and answer their questions in their language. And over a period of time, she was called to be a part of it. And then the doctors started asking for music therapists to be a part of the team. So you can see that how it happens is that the experience, the change that they see in the mothers and the children in ICU, the doctors would find that music can play an integral part. So if it helps with the child and the mother bonding with music, they would want you to be there. If it changes the environment, they would call you to be there. So, and it's also about our ability to put forth the experience of showing the doctor. Apart from this, it's about the structured way of working, the documentation assessment, to be able to explain what we are really doing with music. If we are on that level, integration of music is not difficult within a healthcare, because right now in the last 10 years we have more than 43 publications, and out of that about 35 of them are original articles from different departments within the hospital. Now I have had opportunities to sing live within the catheterization lab. We have sung live during the endoscopy procedures. One of our students was also called to do one of the sessions during cesarean because she was working in the labor ward, and she was and the patient asked for the therapist to be there. So that also plays a major role. How the it's like a cycle. How you treat the patient, how you work along with the patient, how comfortable the patient is with you. So they would want you to be there in the clinical work. And when the doctor finds that there's a cooperation level, then they would want to, oh yeah, it really works. So let's have more of these people. So I find that music therapy plays like a connection between the doctor and the patient. Sometimes the doctors don't have much time, which is totally understandable. And so if we can create that, take up that space between the doctor and the patient, I think then we sort of become a part of it. We are not complementary anymore, we are more integrated into the system. So we are working along with the interdisciplinary team. The nurses know that we are doing something, the PGs know, the doctors can see. The publications that we bring out gives them a more scientific outcome to the work we are doing. So more objective work that they most of them it's quantitative. They need to see numbers. And if we can show them numbers, then they'll start believing it. So no, it's not just the patient's feedback; it's also numbers that we are showing. So if we continue to do this and we have more robust scientific evidence, I think integrating music into a healthcare system won't be difficult. And this university has been, Sri Balaji Vidyapeeth has been quite supportive of the work we have been doing. So I'm happy that we could do this, and I'm also very confident that if we have qualified music therapists, it will grow much more faster within the Indian context.
You have been involved in organizing several international conferences and workshops. How important do you think these events are for the field of music therapy?
Okay, yeah. So one thing is advocacy. We need to talk about the work and to bring out what we are doing to the general public. Now, if you can see, the first conference we had only people from nearby, but then slowly now we also see there is an integration of medical people who want to come into the conference. There are just musicians who want to join. There are people from all over the country, and there are also people outside of the country who want to know what we are doing. So the idea is, first thing is advocacy. Second thing is to spread the awareness of the work we are doing. It's not just bringing someone and talking about it, but it's about showing the kind of work we are doing. So it's real time experience. And also when we do this, we also provide a foundation and an understanding that there is an educational aspect to it. So we also create space to say that we involve educational aspects. So we can get in more students who might be interested in the future. There may be interns who are already doing a PG diploma somewhere and want to come here, because here within this university we are doing core clinical practice with patients. And it's not just once in a week like it happens in most other countries. We are doing it on a regular basis. We have so much of foundational work that we have done. So the practice and all that should be brought out. So I think the most important is advocacy and awareness, also to bring out that the important work, and to create that space for people to come back and to build this place. So the moment we have something very credible, people want to come there, and the credibility is what is caused with music therapy. So when we bring in international faculty, because within the country we are still developing a lot. We don't have many PhDs. Like only this university has a PhD program. We yet to come up with more PhDs. So we have to bring in people from other countries who have much more experience, and that way what would happen is they would contribute to what we are doing right now. So now we have this within the Indian context. So when we have, let's say for the upcoming conference, we have Dr. Annie who's coming from Anglia Ruskin. She would collaborate. So we have a chance to collaborate between countries, to do research collaboration. So people know that we are connected to not only the Indian context, but also the foreign aspect to it. Sometimes in India, we all look out for that global connections, which makes it a much more better place for people to want to come here. That is just another allied point. But I think this collaborative work of student exchanges, faculty exchanges, learning more. What we have here, we don't have what the other countries have. And what we have, other countries again don't have. So there is this chance of collaborative work. So I think these conferences play a very important role.
As someone who has contributed significantly to the development of music therapy in India, what are your hopes for the future of this field?
Okay, I'm actually positive. Like I said, there are more people wanting to join. But I do think they're still little apprehensive about the jobs that are still not there as sure. So the future would become better when we have a more credibility, more opportunities for jobs. And I am looking forward. Like I said, I think I mentioned it that most hospitals are asking, or more other universities are asking for it. Also, with the change in the new educational policy in 2020, most of the universities are looking at all of these holistic therapeutic aspects as well, music and yoga and Ayurveda and everything. They're looking at different aspects that they can bring into the universities. So I think if we have enough people from here, there is a possibility that we can create a niche space in most of these areas. So now Sayan, you itself are from West Bengal, and we have at least 3 or 4 of them who have studied from West Bengal. Now we know in Tamil Nadu we have 3 or 4 of them, and we know there are some in Mumbai, some of them from Gujarat, some of them from Bangalore. So when we create more students and they all go back to their places, the ability for us to take it forward, that is when it becomes better. And then it's not just spreading but coming back. So I think it's the whole process of educating students and making them capable enough to go ahead and confidently speak about the work that they can do. And that work comes from their practice. And that is quite scientific and robust within this university. So the hopes are that we'll have more qualified music therapists who can build the profession. This is the whole point. So the future lies in us building it. We're all pioneers of music therapy in India. Qualified. As qualification is very, very important, and we still don't have it. We don't have a license yet. So my hope also for the future would be to try and do something on those aspects. But yes, I'm very positive about it.
That's good.
Go back to. What advice would you give to students who are interested in pursuing a career in music therapy? And why did you become an academician rather than a music therapist practitioner?
I think I already said that. No, I enjoy being a practitioner and I really miss it, like I said. But I think at one point it is about bringing in more students. So it's about giving you the opportunity to go there. So I try. Right now, I'm not able to go much out, but my idea was to go about and supervise. I was able to do it until the last batch. I went out sometimes when they had difficulty during the practice. I would go there to support them. And yes, it's one area that I really miss. But as an academician, I think the ability to develop the profession in the country makes it possible only then. Like I said, we need qualified people, and for that, we need teaching people, and for that, I need to be there. And I feel that I can give what I have, not just with experience, but also to bring in the theoretical aspects and to connect it, to be able to support the students across. So yes, I am continuing to do my research work. I'm hoping I will do more research in the future. Once I finish my PhD, I'm thinking I can do a postdoc and again get back into patient care, even if it is for 2 3 hours a week. Definitely, but the I think all of us at some point will have to become an academician if you want to develop. If that is the idea that you want to develop the profession in the country, we need to get into academics, and that's one of the areas that creates a better space for the development of the profession within the country. So academics also is very interesting. Like I said, I think in the beginning, when I'm in academics, I can tell what I have experienced. And when you have people who will tell you real time experience, the learning aspect becomes easier, makes it more easy for you to relate. So I think that's why I wanted to be. I didn't think I was going to be an academician. I don't think I thought about any of these things, but I started becoming very stronger. I've got stronger thoughts about it. But yes, we need more academicians and more practitioners.
How do you stay motivated and continue to grow in your field?
Yes, I think bits and pieces I've said here and there. So in the beginning, well, even now, my motivation would be patient care. Patient care is the crux of motivation, and that can, for a beginner, be the demotivation as well. But I think the changes that you see in the patient, that has always been my motivation. Whatever issues I've had personally, or in my workplace, or in my educational places, going and meeting the patients has always cut those out. Always looking at it and saying that I've been there for them, or I have made them smile, or I've made them talk about their issues, has always motivated me. And from there on, like I told about getting into academics and teaching, when you look at how much you can impart and how much they are able to take from you this, as students, I think that's also very motivating. So I'm also learning as a process of it. So I understand that I must change myself, and that gives me a lot of motivation to look at the youngsters and say, oh, you've got such beautiful ideas. How do we translate that into practice? And that only sort of makes my brain work more, and very excited about the prospects that I can see, because it's, and if that, and that also gives me an idea of how can I pave a way for the students to do better. So if I was able to do something with biomarkers and I had to spend the money on my own, but if there's an opportunity that I can get funding for you, and if the getting into academics or getting into a better position will help me to do that, I think that is the best thing that I would look forward to. So if someone would do biomarkers in the same area and do more, and that's what would motivate me to do. And that's what I'm futuristically looking at. So this really motivates me. Like, I think clinical practice, teaching, it's all about the responses you get, and responses have been quite interesting. Yeah, some not good, but yeah, I think I learned even from that.
Now experience of 10 years and you're stepping into your 11th year. Well,
Yes, yeah, yeah, it's really been interesting. I don't feel like it's been 10 years, but I don't know. I think through the process, I did go through some hell and some heaven and some in between. But it is not, it has brought me to who I am now. So even through those difficult periods, if I'm able to smile now, I think it's because of that experience I've had. So filtering out and talking to yourself, building yourself as a personality. I think that's what will keep you motivated. Always looking at yourself and not always looking at the outside world. Not always trying to understand who you are. I always tell students when they join, it's not just you becoming a music therapist, it's you as a personality who's going to change from this person of who's learned music to a music therapist. That's the process. And if you learn that process, I think it continues after that.
So I think I've come to the end of the session. I have one more last question. We'll be done.
Yeah.
Can you share any upcoming projects or research that you are excited about?
Yeah, actually, yes. Actually, one is going on, so I'm just waiting for it to finish. But there are other students who are coming in, and I'm looking at how I can work with the student who's looking at uh, ragas, and it's very exciting because those thoughts haven't come into my mind. So it is when the student is saying that, oh, you know what, I want to do this, this is why I want to do it, and paving the way for them has been really exciting for me. So I'm looking forward to working with what's his name, I just joined, Vinod. He was talking to me about wanting to do research. He came here only to look at whether he can do research. And he is looking at sleep. So, as sleep, though there are studies, there are no quantitatively strong studies. So, I'm thinking that could be one other way. And another study that's ongoing is by one of the students who's doing in oncology, and we are using techniques like music collage, and all of these are new techniques. So, my idea of looking at these researchers in future would be more of understanding the music therapy technique that is bringing about the change. And so all of this really excites me. So I'm looking forward to all of this. And I'm hoping that the postgraduate diploma will move on to master's, then I'll have more exciting things to think about.
Okay.
Yeah, being paid.
Okay.
So is it true that you are the first PhD candidate in music therapy like in India or in the
I don't know if I should be claiming these things, but within the university, with a department and a school, yeah, this the PhD in music therapy would be mine, because the PhDs from outside have done it from a department, not a music therapy department. So in that way, I would suggest, yeah, probably the first one who's doing the PhD and hopefully completing it. The same thing would happen with my masters, because we inaugurated the master's program and I joined and I finished it. So that would also that would also probably be the first in that case. So,
Okay.
yeah, so a little awkward, but yeah, that's true.
Okay. Uh, Thank you, ma'am. And we really appreciate that you accept our request to having interview with us. And we really feel honored.
Thank you so much. It's a pleasure talking about all of this, and to talk to you all about it, and hopefully make some change in your thoughts. And if it can take you forward, I think I would have made some change. Thank you so much for inviting me.
Thank you, everyone, who is listening this interview. And I hope you get some information from this interview.
And this is Gauri.
This is Shayan.
Signing off.